So, when you hear the word diabetes, your mind probably jumps straight to type 1 or type 2, right? But what if I told you there's another form, one that's been hiding in plain sight for decades, affecting millions and millions of people? Well, today we're going to dive into a groundbreaking new proposal from a global team of experts that can change how we see diabetes forever. Let's get into it. The usual story we're told is that diabetes fits into one of two boxes. Either it's an autoimmune disease, that's type 1, or it's all about insulin resistance, usually tied to being overweight, that's type 2. But is that really the whole picture? Well, a huge and growing body of evidence is now saying absolutely not. And this is exactly why it's so important. We're not talking about some super rare, obscure condition here. Researchers think that a whopping 25 million people, mostly in low and middle income countries, could have this very distinct form of diabetes. That's a massive number of people who are likely getting the wrong diagnosis and, even worse, the wrong treatment. To really get why this is all happening right now, we've got to go back in time a bit. See, this isn't some brand new disease that just appeared. It's actually a medical puzzle that doctors have been wrestling with for over 70 years. It's a real story of discovery, a whole lot of confusion, and now, finally, a major push for clarity. It all started way back in 1955 with this thing they called J-type diabetes in Jamaica. By 1985, the World Health Organization made it official, calling it malnutrition-related diabetes. But then, in 1999, they made this really controversial move and took it off the list, saying there just wasn't enough proof. And that one decision basically left millions of patients and their doctors stuck in this diagnostic limbo for over 20 years. Which brings us to today. So what changed? What was the tipping point? Well, the breakthrough came from this really important meeting of the minds, which led to something called the Vellore Declaration. Picture this, January 2025, in Vellore, India. 39 experts from all over the world get together. Their whole mission was to go through decades of research, piece together all the scattered evidence, and after a lot of intense debate, they reached a unanimous conclusion. It was time. Time to finally, formally recognize this condition. And this is what they came up with, the Vellore Declaration. It's a formal statement proposing a whole new classification. Now, they're calling it type 5 diabetes, mostly because the names type 3 and type 4 have kind of already been used for other things in research. So this proposal isn't just one group's idea. It has the weight of a unified global scientific front behind it. So the big question is, what actually makes this proposed type 5 so different from the kinds we already know about? Let's break down the key things that really set it apart. Okay, this table really lays it all out. The suspected cause for type 5 is undernutrition, and these patients are usually very lean. But here's the absolute key difference, this unique combination right here. They have severely impaired insulin secretion, but their insulin sensitivity is totally normal. Think of it like this. Their pancreas is like a factory that's just not producing enough insulin. But the body's cells are still really, really good at using whatever little insulin the factory does manage to make. This is the complete opposite of classic type 2, where the factory is often making tons of insulin, but the body's cells are just ignoring it. And that unique profile is exactly why it just doesn't fit in the other boxes. So, to diagnose this, doctors are looking for a very specific cluster of signs. A super low BMI, for one. Then there are tests that show the pancreas isn't making enough insulin. That's what a low level of something called C-peptide tells us. And crucially, there are no signs of the insulin resistance you see in type 2 or the autoimmune markers you see in type 1. Another really big clue is a history of undernutrition, often going all the way back to childhood. Which leads us to the big theory of what's actually going on inside the body. The thinking is that the groundwork for this disease is laid down incredibly early in life, shaped by a person's entire nutritional history, maybe even starting before they're born. Okay, let's break this down. Imagine two people who both experience undernutrition early in life. In pathway A, if that person later gets a surplus of nutrition, overnutrition, they're at high risk for classic type 2. But in pathway B, if that undernutrition just keeps going, it leads to a totally different problem. Let's go back to that factory analogy for the pancreas. In the second pathway, the factory was just never given enough building materials when it was being developed, so it was never built to its full potential. And now it simply can't produce enough insulin to keep up. That's the proposed mechanism for type 5 diabetes. All right, so it's a different disease process. We get that. But why does giving it a name, type 5, actually matter in the real world? Well, it all comes down to safety, and in some cases, survival. For these 25 million people, getting misdiagnosed isn't just a simple mistake on a medical chart. It can be actively dangerous. It leads to treatments that can make their condition much, much worse, not better. Let's look at exactly how bad it can be. If a patient gets misdiagnosed with type 1 and is given standard insulin doses, they could have a severe, even life-threatening drop in blood sugar. Why? Because their body is just so sensitive to that insulin. Now, if they're told they have type 2, what's the standard advice? Lose weight. Take drugs like metformin that can also cause weight loss. For someone who is already dangerously thin, that advice is an absolute catastrophe. Now, this declaration is a massive step forward, but it is not the final answer, and the experts are being really honest about that. This is all about recognizing what we now know, and just as important, defining what we still need to figure out. And there are some huge questions left on the table. We still need to nail down the genetics, find the best medications that won't cause more weight loss, and develop nutritional plans that actually help, not hurt. And to do just that, the International Diabetes Federation has created a special Type 5 diabetes working group to tackle these questions head-on and create clear, science-backed guidelines for patients. In the end, it all comes down to this really simple but powerful goal from the paper itself. It's about finally recognizing a neglected disease, all to improve and even save the lives of millions. Now that the medical world has a much clearer target, the real work begins, making sure that every single patient, everywhere, gets the right diagnosis and the right care.